Beverly mentioned, my name is Wendy Ho. I'm the State Policy Analyst at the Asian and Pacific Islander American Health Forum. We're a national health policy advocacy organization that promotes the health and well-being for Asian Americans, Native Hawaiians, and Pacific Islanders. I want to thank, of course, Beverly and the wonderful team at Aki for inviting me here to speak tonight. And I also want to give a shout out to South Bay First Thursdays for also co-hosting this event. And I have to give one last shout out to the Civic Leadership Program at Poly. All right, so just to give you kind of a brief picture of what I'll be covering tonight, I'm going to go over a couple of social indicators for our communities. Then we'll talk a little bit about some of the programs that are available to our immigrant communities, and really what those budget cuts, we keep hearing in the news about these budget cuts, and really I'm going to talk about how these cuts are really affecting our communities. And then lastly, going to leave you with a little bit of a call to action about what you can do to help fight off. So the rate of limited English proficiency in California, one in five Californians has some trouble with the English language. As you can tell, I know it's kind of hard to read, especially the different ethnic groups that are on the bottom. So on the left, you have the Asian ethnic groups on your left, and then on the right, you have the other racial categories going from left to right: white, black, Alaska Native, and American Indian, and then Latino. So all the races, Latino, for just talking races, not ethnic groups, Latino community has the highest rate of limited English proficiency in California. But if you look at the disaggregated, if you look at the different ethnic groups that make up the Asian American community, you'll see that the Vietnamese population, more than half, 54%, have some type of limited English proficiency. And 50% of Koreans also have limited English proficiency. So within our own communities, there are varying levels of language ability. So we talk about poverty. These different bars represent the level of poverty, the federal poverty level. So there's this really difficult formula to determine what the federal poverty level is. And in 2009, the federal poverty level for a family with three was $18,000. $18,000 in this valley doesn't get you a whole lot, right? Yeah, it doesn't get you a whole lot. So you can see here, again, just like with the English proficiency, there are varying levels of poverty within Asian American and Pacific Islander communities. Again, I apologize, this is hard to read, but if you're interested in kind of getting some of these statistics, we can make this presentation available to you. So you'll see that Southeast Asians, 18.3%, are below the federal poverty level. And the Native Hawaiian Pacific Islander population they have significant rates of their populations who live below the 200%. The uninsured rate for California is 15%. That total is about 6.6 million residents in California don't have any kind of insurance. As you all may know, if you don't have access to healthcare insurance, you're more likely to be prone to certain types of diseases like cardiovascular disease, diabetes, and hypertension. So again, within our communities, we have varying levels of access to healthcare insurance. You'll see the Korean population, number of small business owners, 1 in 3 Koreans in California don't have insurance. They are actually the most they are the ethnic group with the largest uninsurance rate across all ethnic groups. The Latino population, nearly 3 in 10 lack insurance. And it's really kind of scary, especially because medical debt, as we all know, costs a lot of money and is the number 1 cause of bankruptcy. Here are a number of state programs that benefit people, that definitely benefit our immigrant communities, and this provide a critical safety net for the most vulnerable in our state. So the Medi-Cal program is low or no cost health insurance, and it provides health services to lawful immigrants who have lived in the in the US for less than 5 years. The Healthy Families Program is another insurance program. It provides health coverage to 910,000 low-income children, and there are about 71,000 APIs currently enrolled. The Cash Assisted Program for Immigrants, also known as CAPI, and the California Food Assistance Program, also known as CFAP, these two programs together provide critical cash assistance and food assistance to low-income immigrants who otherwise won't have access to these basic necessities. Both of these programs are made available to immigrants who don't have, who aren't eligible for programs at the federal level. The CalWorks program is the state's welfare program. It provides cash assistance, job training, child care, and other supports to low-income families with children. There are about 24,000 immigrants who are otherwise ineligible for any kind of federal aid. And so this really is a great program for them. And about 14,000 of our community members are in the CalWorks. In-home support service, or IHSS, provides in-home health care for elderly and disabled people. I mean, a number of folks in our communities are home health care workers. I know in the Filipino community, the home health care worker population is very, very strong. So the IHSS program provides a lot of means of income for our communities. So we know that California is facing a I wish, a $20 billion budget deficit. And with this recession, basically California is bringing in less than what it spends. So this pie chart shows you what exactly California is spending its money on. The numbers listed, I know they're kind of hard to see, are listed in millions of dollars. Millions of dollars. Health and Human Services and Education. Basically, half of every state dollar that is spent on either education or health and human services. Everything else is just pales in comparison to what we spend on education and health and human services in this state. Despite the contributions that immigrants make in their taxes, legal immigrants have been routinely targeted in these state budget cuts. So, to help close this $20 billion budget deficit, the Governor Schwarzenegger, has proposed some hefty cuts to health and human services. $2.9 billion in health and human services alone. This includes a $1.1 billion cut to Medi-Cal, and this eliminates a lot of, this will eliminate health benefits for legal immigrants who've been in the U.S. for less than 5 years, and it increases the cost of this program to its beneficiaries. $107 million will be cut to the Healthy Families Program. It will change the eligibility level for beneficiaries and increase the monthly premiums for families who make over 150% of the poverty level. And again, just like with the Medi-Cal cuts, we're going to see more people in the ERs, and that's basically going to cost taxpayers more money. So the governor has also asked to eliminate CAPI and CFAP, which will really be devastating to those in our communities who rely on these programs to provide basic necessities. He's also proposing to limit in-home supportive services to people with the highest level of need, and also to cut the minimum wage, to cut the wage that IHSS workers make to the state minimum wage level of $8. And this is just going to be detrimental. It's going to be absolutely devastating. So, what can you do? So, stay informed. Tonight, you're already doing a great thing and showing that you're interested in these issues. I encourage you to join my organization's listserv, and there is a sign-up sheet in the back. Also, if you like events like this and want to learn more about issues in our communities, I highly encourage you to attend the California API Policy Summit, which happens in May in Sacramento. I also have registration forms in the back. You can also write, call, fax, or visit your state representatives. You pay their salary. They are accountable to you. You are their boss. So make sure that you kind of check up on them. And lastly, share your story. The Asian American Voices site is a great place to do that. My organization also has some resources and we'd be happy to help you. And just your voice, your story matters. So let's not take this sitting down. Thanks.